Good afternoon. I'm Steve Bynum, Senior Producer of WBEZ's Midday Show Reset. And welcome to those tuning in now on WBEZ's YouTube page and on Reset's Facebook page. And we thank you for being part of this continuation of Reset's COVID-19 Q&A with Dr. Mia Taormina. So with so many questions about the safety, efficacy, and availability of COVID vaccines, this 30-minute conversation is designed to provide you with another chance to get verified, timely, and factual answers to your questions. And we'll take your questions throughout, so drop them in the comments section, and we'll get to as many as we can. So send them our way. And so today's guest is Dr. Mia Taormina. She's an infectious disease expert with DuPage Medical Group, and she answers your questions every Friday on Reset. And Dr. Taormina also gives expert advice on the latest coronavirus news. Today, we've asked her to hang out with us for a little bit and to get some more of your questions. And so, Dr. Taormina, welcome, and thanks for the additional time.
Oh, Steve, it's great to be here. Thanks for having me.
Absolutely. We really appreciate the service that you've provided for us. And so let's get to one of our first questions of someone who tried to get on the air but couldn't. And that's Karen from Arlington Heights. And her question is, I will be taking a 3-day course of ibuprofen due to upcoming outpatient surgeries. But if I'm able to get the shot, should I refrain?
So that's a very good question. The idea is we don't want to blunt our body's natural response to receiving a vaccine, which could be to mount some antibodies and to have a low-grade fever. And that's sort of part of immunity being mounted there. Obviously, if this is part of your pre-surgical requirements, the hope would be that you can kind of gap the time of your surgery and needed medications and your COVID vaccine. If this is your one and only chance at a COVID vaccine, absolutely get it, even if you're on the ibuprofen. If you have the ability to separate that, the preference would be to not be on ibuprofen before a vaccine. Obviously, after the vaccine, if you're uncomfortable or having some uncomfortable side effects, ibuprofen is also just fine.
Okay, thank you, doctor. And Ruth from Hyde Park wants to know, she said, I was given an appointment earlier than the 4 weeks between doses. Should I postpone?
The preference is to stay right at the interval. So 21 days for Pfizer, 28 days for Moderna. There is a little bit of latitude. You can go up to a few days beforehand, up to 4 days beforehand for Moderna, and up to 6 weeks from the first dose in order to get the second dose. And that may change as well. You might be able to get that second dose well longer into the future. My personal preference is that if you have a choice between a little earlier or a little later, to err on the later side. But again, if that's your only opportunity for the second dose, please get it.
And doctor, how late is too late?
That's a good question. We don't have that answer. Right now, present guidance is that if even 6 weeks goes by between the first dose and the second dose, to just give the second dose when we're able to. And at this point, there's no need for a third dose or booster dose. That advice may change. I actually don't anticipate that it's going to change, that we're going to need additional doses. Right now, European countries are setting the table for potentially not giving second doses for up to 12 weeks later. So we'll see how that goes.
Okay, thank you, doctor. And we have a question from Beverly in South Shore. Her husband has a shellfish allergy and wants to know if he can take the vaccine.
That's a great question. Most people that have allergic responses to the vaccine are individuals that have allergies to other things. In general, the major concern is if you have an adverse reaction or have had anaphylaxis to a component called PEG or polyethylene glycol in other injectable medications. For the most part, food allergies, stinging insect allergies, allergies to medications taken by mouth are much, much less of a concern. I would not have any immediate reservations for someone to get a vaccine if they have a shellfish allergy, but certainly touch base with your allergist. And if you carry an EpiPen, make sure you have it with you just in case.
Dr. Mia Taormina is with us from DuPage Medical Group, and she's here to answer some of your questions online that we couldn't get to during Reset when she was on just now. So please put your question or comments into the comment section of YouTube and also Reset's Facebook page. And so to another question, the winter weather is also impacting vaccine delivery and appointments. And there is a supply shortage of vaccines across the country as well. How could the weather impact vaccinations around the city and state? And will we see a slowdown or delays? Earlier in the show, you had mentioned that there were thousands of vaccines that have not arrived and how that's really sort of set back the work you all are trying to do?
It absolutely has. In general, we were expecting hundreds of thousands of vaccine in the state of Illinois each week. And in this past week, we're talking about only getting 50 or 60,000. Here in DuPage County, where I work, we were getting, 12 to 14,000 doses per week. And this past week, we got about 2,300 for the entire county. Obviously, these numbers are not sufficient to vaccinate the tremendous number of individuals who need vaccine. Those who have some vaccine, I don't want to use the word stockpiled, but saved, they're being reserved sort of for second doses with very few first dose appointments at this moment in time. I'm optimistic as we get into next week and especially into March, we should be able to open up that aperture for more first dose appointments sort of statewide. If you did have a vaccine appointment that was canceled because of one of these delays, you should absolutely be able to get your vaccine rescheduled. And if you've missed your second dose because of one of these delays, be reassured that you have up till 6 weeks to get that second dose. So there should be some flexibility there.
And Dr., how are you feeling about coordination between the major pharmacy outlets, government, you and the medical profession, the pop-up places that have been happening in other states, but we're looking to see more of those here? Do you feel like that coordination is where it needs to be?
There's always room for improvement. And the reality is between commercial pharmacies and their supplies, between counties and their supplies, private entities and their supplies potentially through the counties, there's not a lot of communication between all of those folks. So it's not uncommon that you'll hear private individuals and private entities say, we don't have vaccine, check the county. And for the county to say, we don't have vaccine, talk to your doctor, and to have a lot of patients feel left in the lurch. Programs and platforms like ZocDoc are certainly trying to marry all of this together a bit and try to get a little more coordination with where the availability is. And there's a pretty, for those of us that are tech savvy and social media savvy, the website Chicago Vaccine Hunters has really taken off in the last week or two, where individuals have been very good about posting when and where vaccine is available. And there's been a tremendous amount of success finding vaccine for individuals that have not been able to find vaccine. Another wonderful resource to join at this time.
Great. Thank you, Doctor. Irma on Facebook has a question. I received the first Pfizer vaccine last week. I'm in my 70s, and I had absolutely no reaction at all, not even at the injection site. Does that mean that my body is not producing antibodies?
That's a great question. The reality is we're seeing a very, very robust antibody response in nearly everybody who's been vaccinated. In fact, again, there was a paper out of Israel in the last couple of days that has indicated even after a single dose, we are seeing efficacy with Pfizer up to 85% protection, which is outstanding. I'm glad you didn't have any severe side effects. It does not mean you're not mounting appropriate antibody response. You may have a little more your second go around, and every patient is different. I've certainly have had a majority of people have just a sore arm and potentially nothing more. I know after my second dose of Pfizer vaccine, I had a very minimal hour or so with some mild chills, and that was it. And I happen to have my antibodies checked, and they are robust. They are present. I feel well protected.
And how important is it to get that second injection? What does it do to efficacy to not get that second injection?
So these two vaccines were approved as what's called a Primeboost series. So the first dose is of messenger RNA is to sort of deliver the message to your cells as to the job they need to have. And the boost is what really mounts that immune response. For this reason, 1 week after your second dose of Pfizer, 2 weeks after the second dose of Moderna, or for all intents and purposes, 2 weeks after any vaccine, that's when we should have the most reliable antibody response. So again, in that 2 weeks after your second dose, you definitely still want to lay low. We know as more data is rolling in that there are antibodies generated after single doses of both of these vaccines. But unless there's been a severe adverse response and physicians recommend that you don't get that second dose, the second dose is recommended for all across the board, including those who had some uncomfortable side effects the first time.
Okay, great. So Irma, make sure you get that second dose. Elena, our first YouTuber, has the question, if all parties are vaccinated but do not live in the same household, can they interact as if COVID-19 never existed?
We're not quite there yet. I don't want to say that we can let down our guard to the point of, as though this illness has never existed. It's here, it's with us, it's going to be with us for a long time to come. For the most part, if you are, as we say, 2 doses plus 2 weeks, you should have antibodies and you should be protected against the majority of the circulating strains. As some of these variants take hold in our communities, you may have less protection, and it's impossible to know who might be carrying one of these variant strains. So mixing households, being completely unmasked and indoors, especially in larger numbers, is not going to be something that's wholly recommended at this time. Absolutely, it's easy to say that someone who's fully vaccinated interacting with someone else who's fully vaccinated, the risks are going to be incredibly low, but I can never say 100% as though COVID didn't exist. I'm optimistic that we'll get over this deep freeze soon and the weather will start warming up, and being outside with some increased social distancing and potentially bigger groups is going to be something that we all look forward to as time moves on.
And fingers crossed, my wife got her first one, so we'll see how that goes. And for all of those in families who've had their loved ones get that shot, we know how much it means to them. So we have Susan from our Reset Facebook page. I got a letter from my health provider about potentially being eligible for a vaccine. The letter encouraged me to set up their app and start an account. The account asked for my full social security number. Is that necessary? I don't feel comfortable with that.
If you don't feel comfortable with that, you absolutely shouldn't. I have heard that there are certain healthcare sites that require a full social security number in order to progress onward. To the extent, and again, I don't like workarounds, but to the extent you can enter 1, 2, 3, 4, 5, 6 in order to just get past that prompt, then potentially in person, you can share that information if necessary. You can try to call also the helpline with that particular app to see if that's something that's absolutely necessary, or if they will allow a generic 11111 all the way through in order to get through the prompt. If for something that is not sent as a direct link from your healthcare system, do not give your social security number or personal health information to anyone anywhere. There's a lot of good well-doers on sites like that Facebook page, Chicago Vaccine Hunters, where individuals in the community are doing a great service, getting your name, date of birth, phone number to try and find a spot for you. But there is opportunity as well for individuals that don't have as pure of intentions there. So please don't give personal health information to anyone that should not have it.
That's Dr. Mia Taormina from DuPage Medical Group, and she's joining us for an online extra plus session of her regular Friday chat with us on Reset, where she answers your questions about COVID-19 and vaccines. And so we have no more on Facebook. For someone diagnosed with latent TB, is there any concern about getting the vaccine?
At this moment, there is not. Any vaccine, okay, going back with latent TB for a little bit of a background, this is going to be individuals that have been exposed to tuberculosis at some point in their life, and they have a positive tuberculosis test. These are also individuals that do not have chest X-ray findings, they're not contagious, and they should not be able to spread the TB bacteria. Most individuals are offered treatment. If you've had your latent tuberculosis treated, this should be essentially a non-issue, but many, many, many people have latent TB and get routine vaccines without issue. We should not be talking about dropping something dramatically to the point, dropping your immune system dramatically to the point where TB can reactivate. I am not aware of any cases of vaccine causing that sort of effect, but speak with your provider about getting your latent tuberculosis treated, especially if you're immunocompromised or have other health issues, because as time goes on, you could be at risk of this reactivating.
So there's a question from Ruth on Facebook. Does a late allergic reaction to the vaccine, let's see, for instance, itchy redness near the injection site, what does that look like if you're getting a late reaction?
So we actually know that this is something that does occur quite commonly, to the point where the last issue of CDC's interim guidance did specifically address this possibility, where you're not just getting the sore arm after the first dose, but maybe 5, 6, 7 days later, a large red spot that might be itchy, painful, indurated, or swollen. There could even potentially be a secondary cellulitis or potentially a secondary mild bacterial infection there on the level of the skin. This is something that we do know does occur. If it is more itchy and irritating, you can use a mild Benadryl or hydrocortisone cream. You can take some Benadryl systemically in order to try and blunt that response a little bit. If there's fevers or any concern for a secondary infection process, please speak with your doctor. You might need a little bit of antibiotic. And the suggestion is to go ahead and get the second dose on the other side. Don't skip that second dose. That should not stop you from getting it.
And just like in a case of an infection, should you feel for warmth around the red area as a sign of possible infection?
So there's the nature of the beast here is this inflammatory response can be warm, infection or not. But when in doubt, please see your doctor because, again, there could be a little bit of a secondary bacterial process. The vast majority of red, hot, inflamed, and itchy is just purely an injection site reaction and not typically infection, but you should be seen if there's any concern.
Are there any arm exercises one can do that would help, like they instruct you to get a flu shot?
Not necessarily. Most of the discomfort usually wears off in a couple of days. And for individuals that do have more of that local irritation that happens days later, the standard is to go ahead and give a little Benadryl, use a little hydrocortisone cream, and it should fade fairly quickly. You don't want to put another shot in the same spot in the chance that there is a low-grade infection in the area. We don't want to be delivering bacteria down deeper into the tissue. So use the other arm if needed the second go around.
Okay, and so let's transition into some questions about masking, because as you know, there have been new guidelines that have come out, suggestions that possibly we should double mask. And so Linda, a YouTuber, asks, should a KN95 be double masked?
We don't want to double mask KN95s or N95 masks. That's going to create difficulty breathing. It's going to be a little bit too much in terms of layering on your face in that form-fitted nature of a KN95 or N95 mask. As healthcare providers, we often put a simple surgical mask over our KN95s because when we're rendering patient care, we could get splashed by some type of fluid, and we want to protect the integrity of the outside of our N95 mask. That surgical mask is then disposed of. So if you're running outside and the weather's poor and it's raining and you want to protect sort of barrier wise that N95, that is okay. That second mask over an N95 is not supposed to be providing any additional protection per se. The N95 in and of itself should be sufficient. Double masking, as researched and as published in the most recent CDC updates, is for a simple surgical mask covered by a cloth mask in order to get that more form fit above the nose, below the chin, and on the sides of the face.
So it's every bit as much about the seal than anything else then.
It is. There are even devices that can be bought on Amazon and like sites that actually create more of a seal that teachers have used in order to get a little more protection. There's sort of molds that can be between the layers of a mask, a cloth mask as an insert to create a little more of a seal. For someone with a narrower face like myself, I usually twist up the sides of the ear loops in order to create that tighter fit as well, but you can knot them too.
Okay, very good. And then staying with masking, as we're being vaccinated, what should be the continued protocol regarding wearing masks? Should mask wearing become a cultural norm like they are in many Asian countries?
I think that we're going to be seeing masks for years to come. I think that when we look at pre-COVID times, the fact that we sort of are okay with and never really thought about the fact that 40 to 60,000 Americans die every year from influenza. And here we are wearing masks for a different pandemic, and we have virtually no severe cases of influenza being reported. As an infection specialist, I've seen one case of influenza in the hospital this entire year. Certainly there are more to come, but to the extent where something as simple as wearing a mask during peak viral seasons is protective, especially to those that are the most medically vulnerable. In addition to vaccine, I think that we have created a trend that should very well continue for years to come. For healthy individuals, we will come to a point where masks are not needed or required in indoor spaces and outdoor spaces as well. That will come at some point. But for all intents and purposes, individuals that are not feeling well, that are sick, maybe with a mild cough or cold, going out and about to a grocery store, the social responsibility may be such that it's commonplace to wear a mask for forever from now on. I think we are forever changed.
And just pulling from the news, something very unfortunate, wanted to get your take on it, Dr. Taormina. Earlier this week, the federal government seized an operation that was selling over 10 million fake N95 masks to hospitals and medical facilities in 5 states. We don't know if Illinois is one of those states. What's your reaction to that? And what are some of the safeguards or recommendations you have to make sure that people are buying masks from reputable distributors and retailers?
It's hard. I mean, even the most, robust screening processes, things slip through the cracks, and we're vulnerable for trying to do the best we can to buy the best products, and truly those that are the most protective. And having stuff like this happens, it is a shame that people want to profit on a pandemic. There should be no profits being had here. We are in a tremendous situation where we all need to work together as communities and as individuals, and profiting should not be part of that. If there was a situation where an N95 that maybe I've worn in the last couple of weeks was not actually 95% effective, I would hope that it at the very least is something that was form-fitting around my face and protected me to some extent from any potential exposures. But something like this is truly shameful. And to the extent that reputable distributors can be used moving forward, that would be great. When supplies are limited, people are getting stuff wherever they can, and things like this do happen.
So is DuPage Medical Group in the mask selling business?
We are not in the mask selling business. We are certainly in the keeping our staff and providers and our patients as safe as possible with properly fitting masks that are available at all of our sites. And our providers at this point are welcome to wear two masks if they feel that that will be an additional layer of support for them as well.
All right, food for thought, doctor, food for thought. So let's go to Jerry. He's a YouTuber, and he says, I am in DuPage and registered for the vaccine. I'm also age 77. How do I also indicate that I am diabetic?
Good question. Generally, it's just a checkbox saying that you have additional medical comorbidities. There may not be one of those boxes that specifically says diabetes, heart disease, asthma. It just will say, do you qualify based on age and medical issues? If you are a part of a system like DuPage Medical Group, you are automatically assigned a risk score based on your electronic medical records capacity to pull in all your health data and assign points for various health issues. So every single patient has a risk score. It's not something you need to know as a patient. It's part of what the systematic process is in order to get vaccine out to the most vulnerable medically the soonest.
So earlier we had a person with a question about taking ibuprofen and receiving the shot. Mike, who's also on YouTube, has a question about Tylenol because he says he's getting conflicting advice about using Tylenol to mitigate adverse reactions from the second shot. What are your thoughts on that, doctor?
Sure. To the extent that you get a vaccine and feel mild symptoms that aren't bothersome, for lack of a better way of putting it, let your body do its thing. When I had a couple of hours of mild chills there, I'm absolutely certain I could have taken some Tylenol or ibuprofen and made that go away sooner, but it wasn't bothersome or impacting my evening or anything. But if you're getting fevers to 102 and having a really robust response to the vaccine, by all means, take some Tylenol or ibuprofen if you are able to do so in order to kind of make yourself more comfortable. That's not going to be something that is wholly damaging to the immune response. What we're advising against is what we kind of say is pre-gaming. No need to take Tylenol or ibuprofen 30 minutes before the vaccine when we don't even know how our bodies are going to respond. This includes if you didn't take anything for the first vaccine, had terrible fevers and body aches and chills afterwards. Please don't take something before your second dose. Let your body start to do its thing. And if you feel those symptoms ramping up, that's when you can go ahead and take some medication if needed.
So whether acetaminophen or ibuprofen, the same advice pretty much.
Absolutely. Some individuals are only allowed because of medical reasons to take one or the other. So whatever you typically take.
And so our final question will come from Sarah on YouTube. Does the vaccine affect the efficacy of COVID testing?
It does not. There's no impact at all between receiving the vaccine and having a COVID test done. COVID tests are looking for PCRs and antigens. This vaccine is going to be generating antibodies to the spike protein. The two just don't interact. So it will not impact your ability to have a COVID test. And if you have a positive COVID test, that should be regarded as a true positive. There are no false positive tests because of the vaccine.
Well, Sarah, that's our last question for today. Thank you so much for participating. And thank you, Dr. Taormina. Thank you so much for giving us the extra time to answer your questions today. You're going to have to start putting us on an hourly charge if we keep asking you to do things for us. We really appreciate you. Thank you.
I appreciate it too, Steve. Thanks for the opportunity.
Absolutely. And thank you all for viewing on WBEZ's YouTube page and Reset's Facebook page. And please do us a favor and follow us for more content updates. And be sure to tune in to Reset this coming Monday, starting at 11 a.m. And for, actually, we've got some more news to give you. If you're free on Tuesday evening, and we invite you to join Reset's Sasha Ann Simons for a virtual event with friendship experts on how to meaningfully nurture friendship bonds during the pandemic. And you can find out more information about that virtual event at wbez.org/events. I'm Steve Bynum, and for Dr. Taormina, we both hope that you will have a great weekend and that you all stay safe out there.